All right, we're live. Good evening, everyone. I am with John Petrizzo right now, Dr. John Petrizzo, DPT, Doctor of Physical Therapy, and a professor at Adelphi University. He is educating the next generation of PTs as well. We're going to get right into some stuff, but how are you tonight, John? Good?
I'm doing well. How are you?
Good. After a little bit of technical difficulties we had working through it, but here we go. So I want to get right into some things. You recently published something, I believe it was in October of 2018.
Yeah.
And one of the things that you expressed, I think, when you posted it on Instagram, that you weren't very happy with it. John is a specialist in strength and conditioning and very into developing strength. He was my powerlifting coach. I believe this paper that you wrote was about a linear strength training program, and why don't you tell us about it, how it went, and what the goals were?
Okay, so the idea behind it came from my association with Starting Strength, which you're aware of, and you know, the Starting Strength linear progression, which has been written about by Mark Ripito and is a popular internet-based, you know, strength program, was something that I wanted to test to a certain degree and get into the literature, because most of the resistance training literature that's out there focuses on periodized resistance training. And currently it's focused on various different templates of periodized resistance training. And my goal was just to get something in the literature that showed that a linear progression could be a effective way for a novice to start out their resistance training careers, as opposed to starting with a more complex periodized program where by definition you're making slower progress, right? So as someone who's just starting out with a resistance training program, if you've never trained before, you have the ability to make pretty rapid progress over the course of your first couple months because you're totally unadapted to the stresses of the resistance training program. So that was the goal. Like you mentioned, I wasn't totally satisfied with how it came out, not because the protocol wasn't carried out well. I actually think that we got some pretty good results, but you know, over the course of the review process, having to make different edits to the paper and things like that, that's just kind of the way it goes with these types of articles. And the finished product wasn't really exactly what I had in mind when I started working on the project, you know, but it just got to the point where I needed to publish it because I've been working on it for several years. For full disclosure, my tenure review is this year, so I just needed to get it done, basically. So I just, you know, got it out there, and I'm glad that it's done, but I would have liked to have been able to present the data a little bit differently than how we did in the paper.
So just for listeners who aren't familiar maybe with some of the terminology, linear meaning that every time you go to the gym for your lifting program, your exercise program, you're adding weight, correct?
Right. Okay. Yeah, so a linear progression, the way that we defined it was every single time you go to the gym, you have to increase the load that you're used. And the exercise that we tracked primarily was the squat. The participants in the program had to squat at every session. They trained 2 or 3 days per week. That was up to them. And basically, we tracked how long a period of time they could make workout to workout progress on the squat, in addition to doing, you know, their other lifts. But the reason that we primarily tracked the squat because it was the only exercise that was done at every session. That's different than a linear periodization program, which is kind of that classical periodization split where you start or model where you start with relatively lower intensity, higher volume, and then taper that down to a higher intensity, lower volume program over the course of several weeks or months. So I think those two terms get confused a little bit by people sometimes. So linear progression is different than a linear periodization.
Sure. And I would agree with you that I think a novice trainer or someone just starting in the gym, really, right? Because we don't have to talk about super athletes here, but someone just getting back into the gym, I think a lot of the changes that initially happen are nervous system wise. Their muscles aren't getting bigger necessarily.
Right.
So going linear actually makes sense.
Yeah.
So if you could have any resource at your fingertips that you needed to prove this, to make it go the way that you wanted it to go, and you had all the time in the world to do it. And I think this is important too, because people just read things in magazines or online and say, oh, this study was done. Look at this. This must be the new thing to do. But let's talk about the reality of what you would have done and why that it's difficult to get published to begin with, and how that all works.
Okay. So it's challenging from multiple standpoints to get anything published. Anything that gets published through the peer review process, it's a much more stringent process than just getting something published in like a lay publication or an online blog or something like that, right? So anything that you submit to these peer reviewed journals gets sent out to several experts in the field in that particular area. And it gets scrutinized, it gets heavily scrutinized. And oftentimes, I've been fortunate to have a total of 5 publications at this point. And there's never been a time where we've submitted it and the journal said, oh, this is great, we're going to publish it as is. It has to go through the review process. And oftentimes the reviewers have critiques and suggestions and things that need to be changed in order for it to become a stronger publication, in their eyes. So it takes a long time. Now, from the process of this particular study that we did, it was a 12-week intervention, right? So we had to recruit subjects that were willing to train for a period of 3 months and dedicate themselves to the program. In my experience, it's much easier to do study designs where basically you're just doing like pre and post testing. They show up on 1 or 2 days, right? And you test a particular intervention. A lot of like supplement studies are done like that and things along those lines, or like the effect of caffeine on performance. You do like a something like that, as opposed to these more longer term types of study designs. So we had over 50 subjects in total. So to be able to recruit that number of people and get them to participate for that amount of time was, I think, challenging. And really what would have made the study better was if we had some sort of control group. So we didn't have a control, so basically we were just testing the program itself to look at the results before and after. It would have been better if we had another group that we could have compared it to. But because of the challenges in just recruiting subjects and getting enough to participate in the study, we wanted a large subject pool, as large as we can get, and we didn't want to cut that in half by making a control group. In reality, I probably would have had an easier time getting it published if I had a control group. So it's one of those things after the fact. I would have liked to have done that, but it just wasn't. It didn't work out for me that in this study. So you learn as you go.
Were they coached? Did they have a trainer? Were they showed proper technique?
So I trained, I took every single subject through the initial session to screen them, to make sure that they can perform all the exercises safely, and to help them find their starting loads for the program. And then throughout the 12 weeks, either myself or my grad assistants were, kind of observing the sessions and things like that. So the one thing though, so we were just, making sure that everybody was lifting and progressing appropriately and that they were actually doing the study, doing the intervention. But we did not do is select their load increases for them. We wanted them to self-select their load increases to see how that impacted their ability to carry out the program. So I think that's something else that was kind of unique about the study. If you look in a lot of the different resistance training publications, there are percentages of 1RM and things like that, and it's kind of dictated, the progression is predetermined. So I thought that was kind of a strength of the study, to see how people would actually self-select their load increases. But that was another thing that I think, because there really hasn't been anything published on that before, when we were having it reviewed, the external reviewers were a little bit skeptical of, so you want to control for as many things as possible in these studies. So not controlling for that maybe was a mistake. It just depends on how you look at it, I guess. I thought it was a good thing, but.
Well, I mean, it's very cool in general that it's so new that no one could really even review it properly. And let's just call it that. I mean, you're a practitioner. It's interesting to me because you're a practitioner first, the way I look at it.
Yeah, I would agree with that. Yeah.
And then you've gotten into becoming an academic really later. And to me, that's the person you respect the most, because most people are just go academic, whether it's economist or scientist, whatever. They're missing the whole part of the practitioner where you experience things in it and you do it for yourself and you watch other people do it. So when it's being reviewed, this is interesting that you bring this up. It's being reviewed by people who may not have ever experienced these things themselves.
Yeah, I would agree with that. I mean, I certainly have a ton of respect for people that are able to put out really high quality research publications, but oftentimes a lot of them don't have a significant amount of practical experience, and these are people that, dedicated years to their education, getting PhDs, most of them in physiology, right, in that, or kinesiology or biomechanics, or, some sort of area like that. And then they kind of go right into teaching and research. That's their primary goal once they get their PhD. Whereas I went the other route. As soon as I finished my undergrad, I started working. Right, that's how we met. And so, for full disclosure, you're the person who interviewed me for my first job out of college. Right, almost 13 years ago now. Believe it or not.
Wow, that's crazy.
Yeah, I know, that is crazy, right? And worked in the field for 3 years before I even went back to get my doctorate. And then when I got my doctorate again, I worked full time in the field for a year before I started working in academia. And working at the university has been great. I love it. I love teaching classes and working with students. And research is a part of my job there. So I've had to try and continue to build a research agenda, and I want to do research in things that I'm interested in and things that I think can help people from a practical standpoint. But it's challenging. It's certainly challenging. I don't have the research background that someone coming out of a PhD program would have. With my experience, it's just I'm coming at it from a different perspective than a lot of the people that are reviewing my papers and things like that. So it's definitely a challenge, but it's interesting, and it's something that I enjoy, and I'm learning a lot, all the time, which is pretty cool.
Well, I would argue your perspective is better than most of them because, again, of the practitioner part. And as my powerlifting coach, when I did that one powerlifting meet, and I watched you coach women, men, variety of ages. I watched all those people compete, and then stories of, you had some older gentlemen that you were training, and I believe some friends too were lifting heavy weight, and I've seen pictures and video of this happening. So you integrate it as part of your physical therapy treatment. True?
Yes, absolutely. I think one of the things that drew me to physical therapy was the ability to, take what I've learned as a trainer and as a strength coach and things like that, and be able to work with a broader population of people, and I think one of the things that was really lacking and still is lacking, although I think it's getting better, is a lack of real understanding of progressive overload and how it applies to the rehabilitation setting, right? Because so much of physical therapy, outpatient, orthopedic physical therapy has been, you come in, you get a hot pack, you get electric stim, you get an ultrasound, maybe you get a massage, and then the exercise is kind of the afterthought, when in reality, the exercise is what has the potential to make the biggest difference if it's applied properly, and that's with exercises that create the right amount of stress, that are progressively loadable over time, right? That you can actually increase your strength or whatever parameter it is that you're trying to improve. progressively. And that's how I look at incorporating those things into my rehabilitation programs for patients. It's not that I want everybody to be a power lifter. I really could care less about that, but I want them to do effective exercise that's going to help them get the most out of their treatment. And I think that variations of things like squats and deadlifts and presses, they train a lot of muscle mass. They work multiple joints in a coordinated fashion. They're progressively loadable. Those are all really good things for a lot of the patients that I work with, and I try and scale them appropriately so that they get a positive training effect from it.
So as you said before, we work together at a big box gym.
Yeah.
And when did you decide that you wanted to go from trainer to physical therapist? Was that prior to starting at the gym, or did that happen over time?
No, so, my undergrad was in exercise science, and I didn't even declare that till my junior year. I really didn't know exactly what I wanted to do. Then once I got out, I wasn't really sure, where I would go with it. And the reason that I chose physical therapy was not so much that I loved the idea of physical therapy so much. It was just, I thought out of the options that I had, and I was considering going back and getting maybe a master's in physical education, working in the schools, getting a master's in exercise physiology, or, pursuing physical therapy. I just thought that physical therapy would open the most doors for me, from a career perspective. And like I said, I wanted to broaden the scope of the population that I could work with, and that's what I saw physical therapy as being able to do for me, was just allow me to work with more people. And I thought that was interesting, and that's really why I wanted to pursue it. So I didn't have my mind made up at all. I was really going back and forth about several different things before I decided to go for physical therapy.
So besides then what you said earlier, which is that you would like to see better, let's say, strength training or implementation of exercise programming in physical therapy, what else is different than what you expected going into the field? What are the other things that are glaringly obvious to you that need a change or are changing or should be changed?
Well, one of the things that I tell my students, because they're all exercise science undergrad majors like I was, and, a lot of them want to go into physical therapy, and they have some background in personal training and things like that, is that it's not that different. The two fields aren't as different as you would think. I kind of went into PT school thinking like I was going to learn some magical stuff, about the body and how it adapts to stress and things like that. And that really wasn't what it was about. I learned a lot of great stuff. I loved PT school. I found it to be very interesting, but there are no like magic secrets out there. And so it's more similar than it is different. I thought that it was going to be so different than doing personal training, like how you and I did it. And it really isn't that much in the orthopedic outpatient setting that I work in. Obviously a hospital setting is very different when you have inpatient, that population, people that are bedridden, that have had open heart surgery, or, these major health complications, then it's a whole kind of different world. But the outpatient orthopedic setting is not as different from personal training as people would think. A lot of it, I think, is still based on developing a good rapport with your clients and patients, right? Building up good trust with them so that they know that you're only going to do things that are in their best interests, and try and help them as the best you possibly can, And for me, like I said, getting the doctorate in PT really was just a way to help open up some more doors for me. But it's not as different as I maybe thought it would be initially.
Okay. And are people leaving your physical therapy treatment with programs that they should continue? Do you try and write them maybe something a little bit different than they would just get, like the standard, here's your piece of paper that has these exercises that are going to help your shoulder?
Yeah, so I have at my clinic that I work at, we have a lot of patients that kind of finish and then continue on and do like a wellness program with us. So it's essentially personal training. So I would say at my clinic, 60% of what I do is like straight up traditional, physical therapy patients. And then 40% is personal training with people that I have done physical therapy with, right? They kind of transition through PT. they want to continue improving their fitness, and then they kind of work with me in that capacity. I do have some people that I, kind of lay out programs with that I'll stay in touch with through email, or maybe they'll come like once a month or once every 6 or 8 weeks for like a check-in session, make sure they're doing okay, and then we'll tweak their program from there. Whatever I can do to continue to help people going forward is what I'm willing to do. It's up to them. They have to kind of make the initiative. Not there are plenty of people that they finish up PT, they feel good, and they say, oh, thanks a lot, I'm done.
Right.
Those are the people that end up coming back, unfortunately, a lot of times. But yeah, if they want to continue, which I encourage them to, then, I'll help them in any way I can.
No, that's like training in general, right? I mean,
yeah, it's the same. It's the same thing.
To that point, actually, would you argue the case for consistency over excellent programming, or do you think they run tandem? So, like you said, you send someone off, and if they do something to better themselves, even if it's conditioning, almost if you change the way they view helping their bodies, do you think that the consistent person is better than the person with the best program?
Absolutely. That's something that I stress to every single person I work with, is that consistency is by far the most important thing if we're talking about your long-term physical health, right? We know that exercise does so many great things for your body, for your health, for your quality of life. And I would much rather have somebody do something consistently 2 days a week for the rest of their lives, if it's something that they enjoy doing, rather than whatever is considered the best program, right? And then they burn out, they can't stick with it, they hate it, whatever it is, and develop a bad relationship with exercise. So as much as I love lifting and all that's my personal interest, I certainly wouldn't force that upon anybody that I work with. I want them to do whatever it is that they can do, as consistently as possible going forward, to keep themselves feeling good and healthy, and whatever the case is. And a lot of them end up liking training and barbells and things like that, but some of them don't, and that's fine. That's up to them.
What role does general conditioning play, would you say, in recovery of even just specific muscle injury? Do you think it's critical? Do you think it helps?
I do think it helps. I kind of, the way I term it with my patients is, the better shape you're in before you get hurt, the better off you're going to be in terms of your recovery. That goes for surgical procedures and things like that, right? So if I have someone who's having a knee replacement or a hip replacement or spinal surgery or a rotator cuff repair, any of those, more of the common types of things that I see, or an ACL reconstruction, I think that the more fit person going into those things are going to have, in general, a better recovery, barring unforeseen complications and that sort of thing. So yeah, I definitely think that having a good base level of fitness will ultimately aid in people's recovery.
Just reminded me that I believe it was in school that you wrote something on flexibility and maybe artery health.
So that was the first peer-reviewed publication that I was a part of. That was my graduate research when I was at NYIT. And so that was a group of, my classmates, with the help of like a faculty peer, or I shouldn't say peer, faculty mentor. So one of our faculty members who I actually still work with on research projects, so he's been very influential. He's been a real mentor to me. Peter Doris practices martial arts, and so he was interested in some of the research that was coming out of Japan in regards to arterial stiffness and the relationship to flexibility. So what we did was we took a group of middle-aged Subakdo practitioners, which is kind of similar to Taekwondo, although he didn't like when I would say that. And we got a group of age-matched sedentary controls. So we had a middle-aged group of Subakdo practitioners, a middle-aged group of sedentary controls. We checked their arterial stiffness using pulse wave velocity. We got the equipment donated. A company was nice enough to donate their equipment for us to do the study. And then we took, standardized measures of flexibility. like you would do in a clinic. We used a goniometer, we did different tests of flexibility, and essentially looked at the results, and the more flexible people had less arterial stiffness. That was what we found. So ours was the first study that looked at the correlation between physical activity and arterial stiffness, and it's been something that there's been more research on since then. But prior to that, all the research on that subject was from Japan. So, and it actually got published in the Asian Journal of Sports Medicine, so which is a pretty decent journal. And since that publication in 2013, like I said, there's been a fair amount of research looking at the relationship between those two things. So it was kind of cool to be a part of.
So knowing that, being part of that, and obviously being a physical therapist, what's the role of stretching versus strength training in your mind? And maybe it's hard to classify like a 60-40, 70-30 split, but and I'm gonna ask you from your own personal fitness practices as well, but definitely what you recommend and what you do with patients.
Okay, so the research on flexibility in general, in terms of the things that people typically associate it with, like decreased rates of injury, recovery from exercise, decreased soreness after exercise, things like that. The research just shows that it's not really, that's not really the case. So I think a lot of the things that people associate with flexibility isn't accurate, so much. But I think that if you're flexible enough to basically do all of the things that you need to do, or that you do as part of your training program, then you don't need to spend a ton of extra time doing flexibility exercises. I think if you continue to do those things that have helped you develop that flexibility, then you'll maintain that, right? If you want flexibility above and beyond that, then you can do specific stretching exercises and things like that to facilitate that. The people that I work with a lot of times are lacking range of motion, right? So they need specific flexibility work to regain that. So whether it's someone who had a rotator cuff repair and they're in a sling for 4 or 5, 6 weeks after surgery, they need flexibility work to regain their shoulder range of motion. So that's a big part of our program. Once they have it, if they're doing things like, let's say, chin-ups or pull-ups or overhead presses, things that are going to make sure they maintain that end range motion, then I think the flexibility work becomes a little less important, So it's a case-by-case type of basis in terms of how much emphasis you put on it. Certainly with patients who are lacking joint range of motion, it's more important. It just really depends, I think,
So playing a game here, I come to you, let's use rotator cuff injury as an example.
Yeah.
And let's say I'm, middle of the road fitness, rotator cuff injury. You send me off, you're about to send me off because, I'm out of PT sessions at this point.
Yeah.
I've met my, my insurance basically limit, and everything seems to be good. And I say, all right, well, I'm going to head out and, I will try and do these exercises, but I do yoga. And I think that's going to be enough for me. Just like generally, you say what to me? What is your response?
I would say that's great if you enjoy yoga. I would say that, and I have conversations like this because people always ask, well, what if I just do yoga, or what if I just do spinning, or what if I just do Pilates, or whatever it is. Most of the time, these different types of exercise modalities have so many of these ridiculous claims associated with it that it's just, people have this idea that, oh, if I do yoga, I'm going to get stronger and leaner and more muscular and, be in great cardiovascular shape. And I try and explain to them, it doesn't do all those things, right? Yoga is a flexibility program. Some of it may be helpful for you. Some of it might not be, not all of these stretches are appropriate for everybody, right? So I would say that, that they probably would want to supplement that. My ideal program for somebody would be a combination of resistance training, some sort of conditioning program, And if they wanted to, some sort of flexibility program, but I think that resistance training and some sort of conditioning should take a higher priority for most people, and then have the flexibility stuff supplement that. I don't think having yoga as your primary exercise modality is going to be optimal in terms of improving overall fitness the way that some of the other things that you could do can.
Some of these things, can you take them to the classroom with you? So when you're, and practicing PT and you're working on someone, do you have aha moments where you're getting asked these questions, or you're treating something specific, and then maybe you go and teach a class the following day? And
oh yeah, I actually think that the teaching has helped my practice, because it's helped me better be able to explain things to patients in like a clear, concise way. But definitely continuing to see patients while I teach has helped me tremendously in terms of the classroom, because I'm always able to pull examples of people that I'm working with, and say, I just did an eval on somebody that has this presentation, just like what we're talking about here. And I think that the students appreciate that. They know that I'm out there actually doing it and not just talking about it. So it's been a really great combination. I enjoy doing both, and I think that they have definitely helped each other from that standpoint. Yeah.
And what does the next gen of PTs look like? Are they on fire like yourself with really, you've told me stories, which I love, where you're bench pressing in your bedroom and the bar falls on you. You have to yell for your mom to come get it off. Is this stuff still happening? Do you see this kind of passion where people are training really hard and very much into it? Or are they more searching for the academic part of it?
It's a mix. I certainly have had some very passionate students, and that's been nice to see. And actually, the study that we started out talking about got some of my students into training, right? Because a lot of them were subjects in that study, and that piqued their interest, and now they've kind of continued with it, and it's been really cool to see. It's always a mix, so I definitely have had a pretty large number of students that I think are very passionate about the field and about exercise, and how they can use that to make a positive impact in physical therapy. And then I have other students that I think, they're just they kind of like exercise. They think PT is a good career and a good job, and that's what their parents want them to do. So, that's what that's what they're doing. And I guess that's always going to be the case, but I see many more PTs coming out of school now that have a real background in exercise and in training than when I was in school. And that wasn't that long ago. But in my particular class, there weren't that many students that had a strong exercise background, or that really had experience training themselves, let alone other people. And that doesn't mean they're not good PTs. It just, you have a different perspective on things when you spent years training yourself, training other people, training for athletics, and that sort of thing. I think for certain areas of PT, like the outpatient setting that I work in, it really helps, and it's nice to see more and more PTs having that type of background.
So as you said, you got your students to participate, or some of them to participate in the study, and you're passionate about powerlifting, and you're part of starting strength. And I think we both agree on, correct me if I'm wrong, regardless of who you are, I always recommend starting, even if you're just starting from the basis and you want to basically burn fat, I always recommend getting stronger first, because you can just do more stuff. Your body will tolerate more things if you just want to do conditioning, but you want to do hard conditioning, right?
100%. Yep.
So what do you recommend when you say to people, you're starting this, here's how not to get hurt. Here's how not to overdo it. Here's how to be ready for each training session. Where do you have that conversation? How does that start?
Well, I think, the number one thing when it comes to injury prevention with resistance training is load management, finding the appropriate starting point. I think people hurt themselves in the gym, which, when you compare injuries in the gym to, any other type of athletic activity, or sport, or things where there are all these uncontrolled forces. And in the gym, everything is pretty well controlled. You have control over it. It's, when you get greedy and you start too heavy, or, too much volume, those are the things that lead to injury, right? Building up so much fatigue too quickly that your body can't recover from. That's how you end up hurting yourself in the gym. So, the thing that I try and emphasize with people is that when we start, we're just trying to find the right baseline for them so that they can incrementally increase over time. I don't care what weight they can lift on day one, right? I care what they can do 6 months from now, and then 2 years from now. That's what I want to see, is that progress over time. And in order to get to that point, you have to start at the right point. And for most people, that's a little bit easier than they probably think they should be, right? Because most people, when they want to get an exercise on an exercise program, they're gung-ho and they want to just, beat themselves up and really get a six-pack in a week, whatever
Right.
it is. And that leads to injury, it leads to burnout, it leads to frustration. So I think that finding the right starting point is the most important thing.
Do you recommend things like foam rolling and specific joint warm-ups for people before they start?
I think that having a general warm-up is a good thing. If people think that foam rolling is helpful for them, that's fine. I don't mind that. I don't.
Wait. But people think it, or you think that it is?
No, I don't. I don't think that there's a lot of research to support foam rolling, and I don't use it nearly as often with people as I did in the past. For certain things, I like it. For like thoracic spine mobilizations or something like that. Or if someone has a history of using it, right, and they feel like it's helpful for them as part of their warm up, I'm not going to tell them no. I'm not going to tell them, well, there's no research to support that, so it's a waste of your time. That's fine, but most of the people that I work with, I start them with like a general cardiovascular warm up on the bike or something like that, stationary bike, and then we'll go right into their weight training type stuff. If I'm in a setting that doesn't have that sort of thing, younger, healthier person, I have no problem with them just starting with light body weight exercises or just very light loads and gradually working up like that. If some people, maybe I'll have to do a specific dynamic warm up, dynamic stretches and that sort of thing, but not many. But some of that is dictated by the facility I work in, how many patients I'm seeing at any given time, all those things kind of come into play. So I think that just a light general warm up, some cardiovascular exercise to raise body temperature, increase circulation, things like that is a pretty good warm up for most people.
This might be a difficult question to answer, obviously, because you see so much stuff. And I would also make the argument that probably most people get injured outside of the gym. You probably see people just fall on ice, or
right.
They rode their bike, too much and whatever.
Right. Totally. Most people that I get hurt outside of the gym, more people get hurt outside of the gym than they do inside the gym, in my experience, at least. Yeah.
But do you see common injuries? Are most people hurting the shoulder over the elbow? Are most people hurting the hip, or is it?
I think statistically, the most prevalent type of injury that people complain about are back injuries. And that's across the population. That's through, almost all age groups. I've had patients for back injuries as young as middle school age, and as old as in their, 70s and 80s and things like that, where back pain is their primary complaint. So I think that is the most prevalent type of injury that we see in physical therapy. But all of the joints, the main joints of the body, so the hip, the knee, the shoulder, they're all prone to different types of injuries depending on your activity, certain structural factors. All of those things kind of come into play. But I would say that spinal injuries, low back injuries in particular, are the number one thing that we see.
So on that, I mean, I would agree that back injuries are like an epidemic in this country, right?
Yeah.
It has people running for opioids. It's so bad, right? For whatever reason. So could we make the statement that or you would agree with that if people were maybe more trained, or people went, out of their way to do some exercise, that maybe there would be less back injury?
Yeah, I think that, our backs are probably prone to having some aches and pains just because of our anatomy, to a certain degree. But I do agree that that exercise, being more fit in general, can help you better manage pain. So I don't think that exercise can prevent necessarily a back injury. I think that if you look at the research on like resistance training injuries, back injuries are the most common type of injury associated with weight training as well, just like it is for the general population. So it's kind of similar from that standpoint. But what I think that exercise and improving your fitness can really do for people is give them better perspective on injuries, right? So what I find is that people who are sedentary, when they have aches and pains, they're kind of not used to it, right? It's alarming to them. They don't want to have any discomfort because they're used to having no discomfort at all. Whereas people who are a little bit more fit, who have spent time in the gym, who have played sports and things like that growing up, it gives you a better frame of reference to know, okay, my back's a little bit sore today, or I'm a little bit tight. I know that's going to get better. I know that's not going to stop me from being able to do the stuff that I want to do. And it's probably not that serious. So, it doesn't cause the type of, anxiety and stress that it would in somebody who is more sedentary, So I think that from like a psychological perspective, being in the gym and being more fit helps you manage injuries better, because it just gives you a different perspective on these things than people who, don't have that type of background.
That's actually very interesting for you to say that, because what you're saying is basically the person's mindset is completely different when they're active and they have a level of soreness or a level of discomfort due to being active, versus the person who is completely sedentary or used to being inactive, happens to bend, strange way to tie their shoe. They're in a little bit of discomfort, and all of a sudden they think their world is crumbling, that they go back.
Exactly. So a lot of the research that's going on now in regards to our understanding of pain is based around something called the biopsychosocial model. So obviously there are structural factors, right? That's the bio part, but there is a large psychological and social impact that can be made in regards to our perception of our pain and, our situation. So I think that from a general standpoint, being more fit, having a better training background just enables you to handle that stuff a little bit better than people that don't have that.
Biopsychosocial.
Yeah.
Okay, so I like this. Can you elaborate? Elaborate on this a little bit more, like the psychosocial aspect? I mean, talk about that. Is there some link between whether a person is integrated into a culture of movement, their friends work out, they work out, or is that?
Well, I think all that stuff plays a role. I think, the social aspect is like, okay, so you hurt your back, right? You go to the doctor. What does the doctor tell you? Never lift weights again, right? Or, like you said, you mentioned the opioids, like, oh, you need a steroid injection, or, something like that. You have a herniated disc, never bend over again. Like, oh, those types of things can cause people to become fearful, right? And develop these like fear avoidance behaviors. So they will alter their activity because they're scared that performing that certain activity is going to cause them pain, or exacerbate their symptoms, or make themselves get hurt worse. And I think, from my perspective, in the PT field and in the medical field, these things. I'm sorry, you hear my dogs barking?
Yeah,
or no?
It happens.
Yeah.
It's okay.
Yeah. So
you have a new dog, right?
Yeah, we got 2 now. Yep.
Yeah.
So
soon you'll have 3, and then they'll outnumber the both of you.
No, two is the cutoff. So I think that we have to be careful in the way that we talk to people about, these sorts of things, that, pain is something that everybody experiences. Most of the time, it's not that big a deal, right? And it's not going to be something that's going to change the way that you exercise, the way that you can kind of live your life for the most part, right? And I think a lot of times, as in PT, you hear PTs all the time, right? I mean, that's one of my biggest pet peeves is like, oh, deadlifts will ruin your back, or, you know, squats will damage your knees. Where do you get that from, right? Where is the data to support that? There is none, right? But it's just, and it creates this mentality that, oh, I can't do that, right? I can't do a deadlift. I can't do a squat, you know? And physicians are guilty of this as well. I mean, I can't tell you how many times I've had patients come in where they say, oh, you know, my doctor said I can never do X, Y, or Z again. Why not? You know, I can never lift my arm up over my head again. Well, that's ridiculous. How do you know, how do you live your life like that? You know, you're just going to like, just put it in a sling and, you know, just forget it for the rest of your life. So, so from my perspective, the way that you talk to patients really has a big impact on how they view their situation, and ultimately can have a big impact on their recovery, you know? So that's where that factors in for me, you know, from my perspective in terms of working with people. And it's something that I've become much more conscious of over the last couple of years as I've learned more about this stuff than I was when I first started. And even though I've always been a lot more aggressive than, you know, most PTs in terms of the types of exercises I recommend and things like that, I certainly am much more careful to make sure not to tell people like, well, you really shouldn't do that. You know, I try and you know, make sure give my patients confidence that they can do more rather than, you know, give them restrictions that they should do less. You know what I mean?
Right.
That's where that psychosocial part kind of comes into play for me.
Well, I think this is an important topic. I'm glad we went here because I've spent the last year getting the Wim Hof certification and doing a lot of breath work.
Mm-hmm.
Where do you stand? Because I feel, you know, there's always setbacks. There's always injuries or, you know, minor, major, whatever. And even if you look at it from the very high level of a super athlete where they have to undergo surgery.
Right.
And it's similar to what we're talking about here, where they now have to overcome the physical injury, but then they have to deal with all of the mental challenges that come along with the questioning of whether or not they're going to be able to hold up. What is the body going to hold up, right?
Yeah.
And maybe that's what we're talking about here. Someone who's new to deadlifting, deadlifts for a week, hurts their back and says, I'm never going to deadlift again.
Right.
Even though that's the wrong way to approach it. Where do you stand with things like breath work and meditation and mindfulness in helping people to recover from these things?
That's something that I certainly don't have a lot of practical experience in. So it's not something that I think I talk to my patients that much about. You know, certainly I have some patients that come to me with that background, right? So they say, you know, I've meditated before. I feel like that's helpful. That's great. You know, I encourage it certainly, but it's not something that I have enough practical experience in myself that I can talk about it from a really educated standpoint, you know?
Right.
So I'd have to bring you in as a consultant for that, I think.
Well, what about people around you though? What about your peers? Are they talking about it?
No, not so much. I at least you know, from what I've seen, I'm sure there are some people out there that are very conscious of that, and I think a lot of this stuff comes from your own experiences. You know, so my perspective in regards to PT was built heavily around my own experiences training, growing up as a teenager, high school, college, the whole thing. So, you know, you have a martial arts background, right? So I think that probably is where you get some of your ideas and perspective from. And I think that, so I'm sure there are PTs out there that practice that way and that encourage things like that. It's not as common with the colleagues that I work closely with. You know what I mean? That's the best way I could say it in the setting that I'm in. But it doesn't mean that it can't be helpful for people, certainly.
Yeah, I was going to say, theoretically, though, based on what we were saying with the psychosocial sort of aspect.
Absolutely. Yeah. I actually, so one of the research projects I'm working on right now, I'm going to an assisted living twice a week to work with people who have mild cognitive impairment and doing a resistance training program with them. And the physician who's leading the study is a psychiatrist, and he was talking with the spouse of one of these subjects. Okay, so she is under a lot of stress caring for her husband, who has mild cognitive impairment at this point and is living in an assisted living. She's going back and forth, there every day. And he talked to her about how much meditation has helped him. And he showed her an app to download on her phone. And she started doing it, like just 10, 15 minutes every day. And she raves about how much better she feels, And so it's been interesting to see that. And it was interesting to see an MD, recommend that, but I think that, again, stems more from his own personal background rather than in his medical, training. Certainly that's not part of formal medical school at this point, and just like it's not a part of, PT school. It wasn't for me. So that's my most recent kind of example that I can use for that. And she loves it, and she talks about it all the time. And now she's encouraging her husband to use deep breathing exercises and that sort of thing when I'm in the gym with him in between his sets, and it's been interesting to see.
Well, it's interesting too, because powerlifting has a lot to do with breathing, right?
Yeah.
There was, one of the first things that we went over when we were lifting heavy weight was, taking the breath and holding the breath and using that in that particular way.
Right.
So I think we agree when we say that, that moving the diaphragm and controlling the core, filling up with air at the right time and emptying with air at the appropriate time is important even during powerlifting.
Yeah, I would agree, certainly.
What would it take for you to explore more breath work? If I said to you, I think that it's going to make you stronger, I think that it's going to improve your powerlifting.
Yeah. Let's do it. Yeah, if it'll make you stronger, yeah.
So, what is your training program right now? Because I say that because I know that I watch your lifts a lot on Instagram, and it seems like you're training for another possibly competition, but I'm not really sure.
I do a couple competitions a year, just local stuff, and it's kind of dictated by, first for me is always work. That's so my training never comes at the expense of work. So I teach 4 classes a semester. I teach in the summertime. I work at my PT office, 25 hours a week on top of that. And so I fit in training around that schedule. So I generally will lift weights, 3 days a week, nothing crazy. I do conditioning another couple of days per week, just like a half hour of interval work or something like that. And couple times a year, I'll try and focus my training towards peaking for a competition. But training for me is my primary hobby. So whether or not I'm competing, I'm always going to be training. I couldn't imagine just not doing it at this point. It's just part of my life.
Right, because you like working out.
Yeah, of course.
But you said a lot of important things, because one of the main pushbacks we get as trainers is that, I don't have time, right? Or people always say they don't have time.
Yeah.
Now, it happens to be a hobby of yours, so you have time to do it. But you also said that you're busy and it depends upon your schedule, and that you work around your schedule. Yeah. So if you're recommending a simple program for someone, how do they fit it in? Is it, you said 3 days a week, and you can do conditioning for just a half an hour. So what's your recommendation for, listen, I know you're busy. I'm working all these hours too, because you just blurted out, you're working 180 hours a week, whatever. You're working every hour. So what's your recommendation then to someone who says, I don't have time? How do you stack it all together so it's like I got all this in
right? You make time for what you want to make time for. For what's a priority for you. So I think that the easiest thing when you're working with somebody in person, they've already created the time in their schedule, right? So if they're coming to PT or they're coming to train with you twice per week, there you go. It's already built into your schedule. Now the key is getting them to adhere to that once they no longer have an appointment to keep, because that for a lot of them is what facilitates the compliance. They have an appointment, they don't want to cancel the appointment. Hopefully you get them to the point where they're enjoying training enough, where they're are seeing the positive benefits, the impact that it has on their overall quality of life and their health and how they feel, that they want to continue that forward. So the way that I kind of have that conversation is you've already dedicated the time to this. You've already carved it out. Now you just have to, continue with it. For myself, I plan out my training times at the start of every semester. I look at my schedule and I look at when can I fit in my workouts. So this is how I'm going to set up my training for this semester. And then that's 15 weeks of training right there. And I stick to that basically no matter what, you know what I mean? So, if you have to adjust, you have to adjust. But if you plan ahead a little bit, it can go a long way. So obviously sometimes things come up, but you generally will be able to work around them if you plan appropriately.
So you said you're doing conditioning for like half-hour bouts.
Mm-hmm.
I like to use fan bike, but
right, same with me.
Okay, so do you feel though, is there a difference, like if you use the fan bike versus pushing the sled? Is getting your heart rate getting your heart rate up? Where do you stand with that?
I mean, for me, I don't see a big difference between the different modalities. Again, going back to the conversation about compliance, I think whatever it is that you enjoy doing that you're going to stick with is more important probably than the modality that you use. So for me, I like the fan bike. We have an assault bike at home, and it's comfortable. It's low impact. It doesn't interfere with my resistance training stuff, which for me is my highest priority, is doing a conditioning modality that doesn't have a lot of eccentric component to it. That's not going to make me sore or fatigue me for my weight training workouts, because that's my higher priority for me. But still, it gives me a conditioning effect. So that's what I'm looking for. There are other people that, if they like swimming or running or whatever it is, that's fine. It's whatever is going to, get you moving consistently, I think, is probably the most important thing.
Well, you mentioned something interesting though, because what if you're someone who wants to be strength focused and you want to not have an injury, but you want to do conditioning, and you said it doesn't have a lot of eccentric motion. So are you recommending, if someone says to you, I want to do a lot of lifting, but I'm going to run as well?
Well, I would say then that's going to affect your resistance training program, and we have to take that in consideration when we're programming your resistance training. So how important is the running to you? If someone tells me, if they're a competitive runner, then that has to take priority. If they just like to recreationally run, that's fine, but then we have to take that into consideration with their programming, So that's the way I lay it out. If they were to do something that was lower impact, that wasn't going to interfere with their resistance training, then we can program them differently. So once you put it in that perspective, then it's up to them. Okay, do I want to prioritize my resistance training? Then maybe I'll run less. Or no, I really like running, so I don't mind if I don't squat as much or deadlift as much because I'm running, consistently. That's fine too. But I just try and be as upfront about it as I can. I'm not going to promise people, go run 10 miles and then come in the next day and, squat and deadlift heavy and, see how that goes for you. So you just have to, I think, present them with the information and see what they want to do with it.
So one of my obsessions is with minimum effective dosage of things. I feel like it's easy to get in the mindset of push, push, push.
Right.
And, I don't necessarily feel 100% today, but this is my workout. I'm going to get through this. I need to do it with people who are not athletes or aren't competing. Right. So they're just very atypical type of people.
Yeah.
How do you think about that with yourself and with clients and with maybe your peers in powerlifting, when you talk about programming and when they're reporting to you, I feel XYZ fatigue, are you more of the mindset, you know what, just push through that anyway? Or how do you determine that minimum effective dose?
Well, I think that for people that I work with, if you're working with them over a period of time, it makes it a lot easier because you're tracking things. You have a big picture kind of view of things over the past several weeks, months, however long a period of time. So you get a feel for what people respond well to. And in terms of that minimum effective dose, you can make one change that can have a positive effect, right? And then you can track how that impacts their training. But I think that the use of RPE has become very prevalent in powerlifting and strength training as a way to manage fatigue. It's a subjective measure, but there's some research that shows, and again, kind of tying into that biopsychosocial model of things, that plays a role, right? So if even if it's subjective, if you feel really fatigued and beat up, that can have a negative impact on your training, right? So it's not always good to just push, push, push. You have to be smart about it. I think that personality comes into play a little bit. There are some people that need to be pushed, right? There are some people that are always going to look for the least path of resistance, right? They're always going to do one less rep, one less set, cut their workout short, or whatever the case is. Those are the people that probably need to be pushed a little bit harder. Then there are some people that you have to actually restrain, right? You have to hold them back because they will just like keep banging their head against the wall because they just like to challenge themselves and push themselves. So I think that it really is somewhat individual, and there are just people that can handle greater volumes of work than others, and so some of that, there's a genetic component to this stuff too. So I don't think that there's one like perfect program out there for people. I don't think that there's one solely optimal way to go about this. You just have to be able to analyze the information that you're given to make the best decisions, for your own training or for the people that you're working with.
Yeah, I think you bring up an interesting point too with people and their intensity and how they go into a workout, because it's almost an intangible. It's hard to explain to a lot of different people, but you watch someone lift weights or you watch someone exercise and you see the intensity on their face and the intensity that they're enacting on the weights, not the other way around, like intensity or volume in a program. And that is almost an intangible, but it's almost the intention that they want to succeed and they're thinking really hard about what they're doing, as opposed to someone just going through the motions.
Yeah, I mean, I think that plays a big part in terms of the effect that you're going to get from your exercise program and how stressful your exercise program is, right? So you can put two people on the same exact program, but the amount of focus and intensity and effort that one puts forth is going to give you different results than someone who doesn't put forth that same type of effort. So there are certainly people that thrive on that, but at the same time, you have to realize that approach is going to be more fatiguing. Those are people that you're going to have to manage a little bit more carefully to help them stay healthy and make progress over the long term, because you can't always push that hard for extended periods of time. It just doesn't work, so you have to know when to pull back.
What are you doing for recovery? Or what are you recommending? Are you icing after you work out? Are you heating? Are you getting into a sauna? What are you doing?
No, I do nothing. I sleep for 5 hours a night. That's my recovery.
That's effective.
Yeah, that doesn't work. It's not. I wouldn't say it's the optimal approach for people, but I try and eat adequate protein, and I don't sleep enough. That is my own personal recovery philosophy.
Which is exactly the opposite of what we were just saying, right?
Yeah, right.
You can only push for so long before you hit a wall.
I'm at 35 years now, so we'll see how much longer I can go for. That's it.
Well, let me tell you, because I'm at just about 38, and it gets harder. So
yeah, I know. But yeah, ideally, I would, if I could do one thing for my own personal recovery that I don't do, I would be to get more sleep. It's just the hours that I work. I don't get 8 hours. Ever. Maybe one night a week I can get that much, but. So I think
as proof through Rory's Instagram stories, you do get some good naps in.
Oh, really? I didn't realize that. I don't follow her on Instagram, so I don't see
probably a wise decision. But
yeah, probably. Did you see my post? Nothing. No. So that would be the number one thing that I would do for myself personally, would be to try and get more sleep. That I think that the research has shown has a really positive impact on recovery from training. I think nutrition, hydration, all that stuff becomes important. I think that passive modalities then they're less important than those factors, right? If you don't have your sleep and nutrition in order, then stuff like stim or heat or ice, that's going to be less effective. If you're trying to compensate for bad nutrition and poor sleep by just getting a massage or things like that, it's not gonna work so well.
Agreed. But a lot of times you have chicken or the egg situation, like things get worse and then sleep gets worse.
Yeah, that's true. Yep.
So, you could say I'm not sleeping well or not sleeping long enough, but then if you were to do things like icing or massage, maybe you would sleep more.
It's possible. Yeah.
So, I've been doing, as part of the Wim Hof stuff, a lot of ice bathing and stuff. And
Yeah.
I want to challenge you and Rory to some of this stuff and integrate it in maybe some of your programming. So we have to get together and do that for sure.
Okay. That would be cool. I would love that.
Awesome. And what's your nutrition looking like right now? You brought it up, and are you just, let me get these calories in, let me get this amount of protein in, or are you looking at specific foods, protein shakes, supplements?
I mean, I'm kind of a creature of habit, so I eat pretty much the same stuff for the most part, almost every day. I have the same breakfast, I have the same lunch, I have the same protein shakes at the same time, just because my schedule is pretty structured, and kind of like I look at my training in advance, like when can I fit in my training? So I know over the course of the day, over the course of the week, this is when I can get my meals in, this is when I can get my shakes in, whatever the case is. And I go through periods of time where I track, a little bit more strictly. And then when I kind of just get tired of doing that, because I am eating the same stuff so frequently, that I fall off with that. My top priority is to get enough protein. I try and eat, a moderate amount of healthy carbohydrates, and then, try and watch my fat intake to a certain degree. And that's kind of but it's not a very strict structure. I mean, certainly, especially when I got into powerlifting and really tried to gain weight, I was eating more, foods that I was not eating for a long period of time. There was periods of time where I was eating very, very strictly, but I couldn't get stronger and get my body weight up to where I wanted it to be, being so super strict with my diet. So I certainly take in a little bit more in extra calories and things like that now than I used to, but I do watch what I eat pretty closely.
Great. Awesome. Well, look, this conversation has been great. Obviously, we can go down the rabbit hole pretty deep on a lot of different subject matter, and we haven't seen each other in a while. We have to make that happen, and I certainly want you to try some of the breathing and mindful stuff, because I actually think it's going to help you with your powerlifting. And of course, being around you always positively influences me to do things differently as well. So I always appreciate that about you, for sure. I may have interviewed you for your first job out of college, but you have been an influence on my training, no doubt. And I think that everybody should make an effort to try and, you don't have a website, but you're on Instagram showing your lifts, which I think is great, because at least it's motivating. You're putting something out there that's motivating people. But where can we find your publications? Do you have
well, so I sent you my personal CV, which I have a Google site for. So if you just search like johnpetrizzo.com, something like that might come up. That's a right. I think so. I don't know. I've never searched it before. So that's just that's my teaching portfolio, essentially. So it's got my CV, it has links to my publications, and the stuff that I do at the university is all there. My Instagram is kind of more of a personal page. I do post some professional stuff on there, but it's kind of just my own personal interests. My wife, Rory, who you obviously know, and who's a PT and a much better power lifter than I am, has her own Instagram, Rory Megan _PRS. Is that what it is? And then Progressive Rehab and Strength. Is that Pro Rehab and Strength on Instagram?
Oh, so I'm gonna get Rory on for in-depth talk, for sure.
She's not nearly as nice as me. She's much more difficult to talk to. So good luck to you
for an interesting conversation. So I'm excited for that. But I know that you're busy. I would say that I think that you should be writing more, and I know that it's probably difficult for you, but you have a lot of great insights and a lot of great experience. You're a great guy in general. You're caring and thoughtful in general, but certainly with training. And I think it's important to talk to some of my peers and let people know about you guys and you gals, because you're doing awesome stuff and you're awesome people, and nobody knows, right? And that's the thing. So we want to get all that information out there. So I appreciate your time, John, for sure.
I've always great talking to you, and I would like to get together sooner the better. My semester's over the 17th, so I have a few weeks of downtime. So let's do it, okay?
Awesome, perfect.
All right,
man. Thank you for your time.
Thank you, buddy.